Your next storyteller, she just wrapped up a 3 months long solo road trip. She is into mountains, biking, and Travis Scott. And she will actually be back on the road again, drumming up awareness about mental health and suicide at college campuses across the country. Please give it up for Erica Hoffman.
All right. How's everybody tonight? Does this mic work as well? Cool. I was referred to go see a physical therapist about a year and a half ago. And since I had never gone to physical therapy before, all I had was an idea of what it was in my head. I imagined lots of stretching, short-lived exercises, lunges, medicine balls, yoga balls. That, however, was not my experience. You see, I was referred to go see a pelvic floor physical therapist. So, rather than doing lunges across a room, I was stationary, I was on my back, my legs were spread wide open, and my physical therapist's finger was up inside and massaging the walls of my vagina. I was referred to this physical therapist after I was diagnosed with vulvodynia, which is the umbrella term for chronic vaginal pain. It's a condition that affects approximately 16% of women in all sorts of different and equally horrible ways. For me, what it means is I experience pain at the entrance of my vagina when pressure is applied to it. So in other words, painful sex. Now, I hadn't always experienced sex as painful. But about a year or so into my previous relationship is when I noticed some sort of change. And I didn't really know what that change was. I didn't know how to describe it. I didn't have the words to put to it. All I knew was that something felt different, and not in a good way. So, what did I do? I kept it to myself for a while. I didn't have the words to describe it, didn't have the language to put to it. I kept it to myself because I didn't want to offend my partner in telling them that sex had become less pleasurable for me. I was hoping it'd be a temporary thing that might pass. Over time, though, that change turned into discomfort, which is when I did ultimately voice it to my partner. And when that discomfort turned into pain is when I sought out a healthcare professional about it. At that point, I felt like it was taking a toll on my relationship. I was feeling like sex was not pleasurable anymore. I wanted answers about my body. I didn't know what was going on, and I wanted to put an end to it. So, doctor number one was my gynecologist. She spent all of 5 minutes examining my vagina and told me that it was a musculoskeletal issue and that she'd be surprised if it was birth control that was causing my pain. She sent me to doctor number two, my pelvic floor physical therapist. She told me that she was confident that it was my birth control that was prescribed, that was leading to my pain. She sent me to doctor number three, a vulvar specialist. And after 3 doctors, hundreds of dollars later, who knows how many work hours missed, bike rides and metro rides all across the city, I finally had some answers about my body. I had a diagnosis. And it's hard for me to describe the relief that I felt in that moment, during that appointment, after that appointment. I think I texted my partner something silly like, I can finally see the light at the end of the tunnel. And that's how it really felt, because for that year and a half, which was how long it took from that first perceived change that I experienced to this diagnosis, I felt like I was living in the dark about something so intimate as my body. It was, whew. So the relief was enormous, but even more than knowing what my diagnosis was, which meant I was closer to figuring out what I was going to do about it, was the relief of feeling heard and acknowledged by this doctor. It was the first time that a doctor, and really anyone, had validated my experience, my pain. She reassured me that it was real and it wasn't just in my head. And that's something that up until that moment, I don't think that I realized that I was missing and that I needed to hear. Throughout this whole process, I've learned how much women's pain goes unheard and entirely dismissed in general and in the healthcare setting. Research shows that 30% of women experience vaginal pain during sex, and a large proportion of women don't voice it to their partners when sex hurts. PubMed has 363 clinical trials studying female sexual pain, compared to erectile dysfunction's almost 2,000. Erectile dysfunction, let me add, doesn't even have to do with male pain. It has to do with male pleasure, which means PubMed has nearly 5 times the amount of studies on male pleasure as it does on female sexual pain. And that's fucking stupid! And why is that? It's because we live in a society where female sexual pain is normalized and male pleasure is a right. And that's, again, fucking stupid. Yes. So, let me just gather myself because that just angers me a bunch. If you don't know, birth control, a lot of birth control pills do alter your hormones. They add estrogen and progestin and reduce the amount of testosterone produced by the ovaries. And what I've recently learned is the skin around the vagina is very hormonal and it needs hormones to work, specifically testosterone. And when there's not enough testosterone, the glands aren't able to do their job in the way they should, and the tissue, the skin around the vaginal opening, thins. During my examination, this vulvar specialist gave me a mirror and showed me how thin and red and irritated the skin around my vagina was. And that's what was causing the kind of burning-like sensation that I felt, typically at the beginning of vaginal sex. And then what makes me really angry is that I continued to have sex while experiencing this discomfort, and ultimately through some pain, more discomfort. It was not comfortable. And as a result, my pelvic floor muscles, the muscles inside my vagina, began to respond by tightening so as to brace myself for the pain. So by continuing to have sex through the discomfort, through the pain, I myself was conditioning my muscles to tighten, which ultimately caused long-term pain. And that's where it gets really upsetting. And I feel a lot of anger towards myself sometimes for not being able to communicate it in the way that I was experiencing it, again, because I didn't have the language or words to put to it. I feel angry because I allowed myself to push through the pain while having sex, and I allowed myself to put my partner's pleasure in front of my own, to my detriment. Of course, I also feel very, very angry towards my ex-partner because he allowed for this to happen. I feel angry towards him because there are lots of reasons. His body language that made it really clear when he was disappointed that we couldn't have sex, or that I had to stop halfway through because it was too uncomfortable for me. For creating a space in which I felt like I kind of needed to continue having sex, even though it wasn't pleasurable for me. I feel angry with him because he didn't hear me when I told him my pain, and he didn't acknowledge it as totally real. The worst was when he would tell me to just breathe through the pain, as if it was a mental thing. Fuck that, right? Yeah, ew. Yeah, no good. And yet I still find ways to kind of like invalidate my anger towards him. However, I wanted to make sure to communicate that because I absolutely have real anger about that. So since my appointment with my vulvar specialist, I have stopped taking birth control pills completely. I was prescribed a gel to put on the skin around my vagina twice a day for about 6 months. I went back to this pelvic floor physical therapist, which was actually great. I went to her on a weekly basis. We sat and chatted for an hour every week, talking about movies, our families, trips we've taken recently, trips we were going on, while she was essentially just fingering me for an hour. It felt, I mean, it was more, I think the emotional aspect of that felt better because it was, again, an environment in which I felt validated and she understood the pain that I was going through and she was helping me physically get through it. That was really nice. More recently, and this is the phase that I've since began as the first time in this experience as a single individual, which at times it feels lonely and isolating to not go through this experience with someone knowing as intimately what's happening to my body. At other times, it feels really awesome to know that I'm the only one who owns this and knows it for what it is. But I've recently become involved in a clinical study as a participant. It's a study that is testing the efficacy of Botox as a means of treatment for vulvodynia, the specific type I have, which is the provoked pain one. So what that has entailed pretty much is me going to this doctor's office, which it's the same consortium as the vulvar specialist. I've gone a handful of times now. I think on the second or third visit, I was actually injected with a needle in my pelvic floor muscles. And because it's a study, it was either Botox or a placebo. I'm not sure what I was injected with still. I'm actually going back on Wednesday to find out. But either way, I recently have had sex and it feels like there is improvement there. So that's really exciting. Yeah. And the point of this study, I think it's mostly well known that Botox is a good treatment option for this condition. And they just need more data because at the moment, Botox is not FDA approved, which means it costs a bunch of money for women to receive it as a means of treatment. And so going through this experience, I'm really grateful that I'm hoping to be able to help women in the long term who also experience this type of pain and condition. But ultimately, this experience has taught me that there are signs that my body gives to me and I need to respect them and I need to voice them. And I'm owning this as my own experience and I'm happy to share it all with you. So thank you for listening and being a part of it.